officials pushing more COVID boosters. Here's former FDA Commissioner Dr. Scott Gottlieb on Face the Nation saying COVID boosters will likely be an annual necessity, much like the flu shot. Let's watch.
Right. We know, 17% of the population took the booster shot, according to the CDC, last time around. Why does someone need to continue to update?
Yeah, look, I think we have to have a lot of humility around this virus. There's a lot we don't understand, and it's continuing to surprise us, as it is with this BA.286 mutation. But this does look like it's going to be a flu-like paradigm where there's going to be new variants that emerge each year. Hopefully we'll guess right in terms of how we formulate the vaccines, but you're going to need updated protection like you do from flu to try to match the vaccine against the variants that's circulating. People are still going to have residual immunity from prior infection and prior vaccination that protects them against severe disease, probably even if they don't get vaccinated. But if you want to update that protection and also get more protection against the possibility of infection, you will need to keep up to date with your vaccine.
Now, this comes as a new highly mutated COVID variant has appeared in Michigan that is likely to be better at escaping the immune systems of vaccinated or previously infected people, but there is no evidence the variant is deadlier than older versions of the virus. Let's keep watching.
Mutated strain of COVID has just shown up in Michigan, BA.2.86. How concerned does the public need to be?
Well, right now, I've talked to a number of virologists who are usually pretty staid, and they're pretty concerned about this. Right now, it doesn't appear to be spreading widely. There's 7 strains that have been identified and sequenced in 5 different countries, so the UK, Denmark, Israel, and now in the US. We don't know whether or not this has been spreading quietly and we just didn't detect it, or it's something that's spreading very quickly. The concern is that when you look at these different strains that have been identified, they're genetically very similar. So that suggests that it's probably spreading simultaneously in multiple countries. Whether or not this is going to be more transmissible than what we've seen before, that's the key question. Certainly at this point, it doesn't appear more pathogenic, so it doesn't appear to be more dangerous, but it may be more transmissible than the strains that are circulating now, and in that case, it could overtake them. It's too early to know. The testing's underway. I think we're going to know a lot more in a week or two. But to, again, put this in perspective, this new variant is as genetically different from Omicron as Omicron was from the original strain that emerged in Wuhan. So this is a highly mutated variant.
Hospitalizations are tracking upwards in the U.S., having risen by about 14% in a week, though still very low compared to the height of the pandemic. So that was an interesting interview with Scott Gottlieb. I mean, I have some questions. He's kind of stressing the need to get boosted the way, some people get the flu vaccine every other year. But then he does acknowledge that there is some lasting protection if you've had COVID in the past, as virtually everyone has, or also had some level of shots, which many, like a vast majority of people have as well. How if this new variant is as different from Omicron as Omicron was from the original strain, how well tailored? We don't have a new booster right now. It's the bivalent booster still, which is the one, right, which is tailored to Omicron, I thought. So if this new strain is that different and we haven't updated the booster yet, I feel like I fail to see why that would even be. And then he does sound, I mean, he's like weakly asserting that you should get it. He's saying that, but you do have some protection. Because it is different, a little bit different from the flu in terms of, not everyone has gotten the flu or gets the flu routinely. With COVID, again, virtually everyone has gotten it at multiple people,
right.
multiple times.
I think also most of us have gotten the flu.
Well, maybe over our whole lifetime, but not in a 3-year period.
I don't know. Back before COVID, when I was not as vigilant about washing my hands or masking in public places, I used to get sick multiple times every winter.
But not necessarily the flu's a specific
I don't know. I used to get, I don't know. I wasn't going into the hospital and getting diagnosed, but I felt like I was getting the flu.
I get sick all the time, but it wasn't, it's usually strep. I get strep all the time. I think I've said that on the show. It's not the flu.
I think that a lot of people do choose to get flu vaccines that aren't necessarily old or vulnerable, because the flu is bad and they get sick a lot. I have at times been in a school environment, or I've been working in an office place where they have, flu vaccines in the cafeteria or something, where it's very easy for me to get one.
My point is, I think the average person has less protection from the flu, frankly, than they do from COVID by now. But
this is the important point. And when I spoke to Dr. Vinay Prasad over a year ago, I think for the first time on my show, and we were going back and forth about this, he agreed with me that at the end of the day, we just don't know. We don't know how long the protection from having had COVID is going to last. Just like there's some ambiguity about how long the protection from the vaccine lasts. And so I completely credit and agree with the idea that we should have been more vocal about the protection that having had COVID offers you as we were planning our COVID policies. At the same time, we're not going to know. Acting as though that immune protection lasts forever seems to be naive. And there's some question about what to do about the fact that at some point there's going to be a fall off in protection. And then what do we do then? Mm-hmm. I would hate for it to be the case that people start to feel so safe and secure in the protection they've gotten from having experienced COVID, that there comes a time where they no longer have that protection. We have not been developing vaccines to address new variants, and people are so turned off by the idea of being vaccinated and have stigmatized vaccines to the point where at a point where we might very much need them again, right, folks don't get them.
Right, although so many people have had the experience of getting the vaccine and then getting COVID sometimes immediately after, sometimes a few months after, sometimes a year after. We've seen, I do accept from looking at the scientific data, I'm not anti-vax at all, that the vaccine has helped reduce severe disease and death, particularly among very vulnerable and at-risk populations, like the elderly, people with health conditions. I think it's done a lot of good. I myself have gotten vaccinated. I probably will get the bivalent booster and a flu shot this fall because I am not persuaded by a lot of the it's harmful arguments. I'm not persuaded by the you shouldn't get them because it's actually a threat to your health. I don't find a lot of that evidence very compelling. I also don't know, the not compelling is on the it's really harmful and it's also really great and important and offers this robust protection and stops you from getting it. That's not been very compelling. Also, that you shouldn't get it because it's super dangerous has not been compelling for me either. If I was a teenage male, a male between the ages of like 13 and 18, I would be a little bit more averse to getting additional shots based on the reporting on that kind of stuff. But I'm not in that age category. I get respiratory stuff a lot, so I'll take it. Maybe it's not doing a lot of good, but I'm not so worried about the harm. That's my calculation. Now, I think everybody should make that calculation on their own in consultation with their doctors if they want. They have to keep in mind when they hear from Scott Gottlieb, obviously, that he is on the board of Pfizer. And there are financial incentives in play, but this just needs to be a decision people make for themselves. It's not, in a lot of cases, I was just seeing that, Rutgers University is going to start disenrolling students that have not gotten the most recent booster. I think it's totally wrong to override people's individual choice and take away their education or employment or anything like that because you won't get a certain number of shots at this point.
So it looks like Moderna, Pfizer, and Novavax are coming out with new versions of their COVID-19 vaccines and boosters that will target the XBB.1.5 Omicron subvariant, which is very similar to this EG.5 variant. They're very closely related, so should work for both of those. But
it's not out yet.
No, and I think that I've seen some on the other side of this issue.
So you should wait for that one.
On the other side of this issue, I've seen some people complaining online that there has been foot dragging and delay for people who really do want access to these more tailored to what's happening right now vaccines. And so, there is this interesting, I don't
don't want foot dragging. I want to make it available. I think the FDA gets in the way of that. But you shouldn't be obligated to take it. It should just be available if you want. I leave it to individual choice.
Right. I don't know what is delaying these particular vaccines, but I do think that there is a way that we can make it easy for the government and for these companies to withhold or make not available tools that people can use on their own volition to protect themselves if we stigmatize those tools too hard. That's my main concern. I'm also very concerned that there has been so much less testing and tracking. Will we know that there's an actual shift and a change in an emergency at a time at which we can actually do something about it? A lot of the information that we have now about COVID rates is from testing sewage systems, because that's kind of the last line of resort, and many municipalities have even stopped doing that. And information is useful. Yes, it can be used to scaremonger and force people into policies that we don't agree with, but it can also be used to protect ourselves. And historically, it has been a technique to control populations to make it so that you can't even measure what bad is happening to them. And so I do have some concerns about that. Is there going to be a public pressure to keep doing the R&D to develop new vaccines that work against new variants if the public isn't buying them, if the government isn't buying them for the public to use? These are all different ways it can play out.
They don't meet even the public's definition of the word work, though, right?
No, but that's my point. There was a time when the version of COVID that was out was killing a lot of people because we didn't have immunity and because we didn't have
zero
vaccine.
baseline protection.
Right. And I'm saying that given that the protection is unlikely to last forever, even from people who've been very COVID skeptical, like Vinay Prasad, are we going to be prepared if and when that shift happens? That's all I'm asking. And if that is not at all a concern for you, then that's not a concern for you. But to me, the point of a public health apparatus is to be guarding against those possibilities, even if they're relatively remote.
All right. Well, tomorrow on Rising, we'll give you updates on a lot of the things we covered today, including Maui's recovery and President Biden's visit there.
Be sure to like, share, and subscribe so you never miss any content. For those of you who like to listen while you're on the go, we are now available anywhere you listen to podcasts.
And we'll see you back here tomorrow.
Bye-bye. Bye.